And it's starting.
Yay!
Hey, good evening, everybody. Welcome to our page, our channel. This channel is it's a way to share good information, positive stuff. Um, People that uh, are having success in their own fields. And in this case, we have a special person. We'll get it in a minute. But we do this once a week, sometimes once or twice. We have great people show up and help us with the great thoughts, great information that's needed at the current time. You know, it's so needed. And so for you guys that are there, if you have any questions, type it in there. We'll get your questions answered. If you have anything that we can, ask Tia along, and you know who she's in a minute. You kind of get an idea on her name there, but I'll read her bio in a second. So we will start in a minute, and I just want to first start introducing. Well, first of all, good evening, and I'll go in the bio. I want to wish each one of you and your families to, I want to wish you guys are well in your homes and safe. Today is a different kind of interview, but it is important, I think, for all of us because we easily forget, and sometimes we learn it, but the more we hear it, the more we pay more attention. And at this time, we need to pay more attention to this for our own safety, for our own family, for our own kids, and our elderly that are around, given everything that we're going through worldwide. I have the privilege and the honor of interviewing a great professional in the medical field, Tia Delaney. She has great experience as a nurse, as a health nurse, registered nurse. And, before I start, I want to thank you, Tia, for, the excellent work you're doing at your work, magnificent work, and that kind of work that you do. It's like very human job because you're connected with the people that are really needing somebody at that moment to be strong,
Mhm.
to hold their hand, to give them faith that they're okay, and that's what
Mhm.
you do. So welcome for that, Tia. Really,
You're
uh,
welcome.
thank you for that. I do want to read a little more about her so you guys really know her. Okay, so it'll take me a minute and then we'll start a little bit. So Tia Delaney has registered nurse. She's a director of patient care services. She's also a current founder and president of Eyes of Love in Nursing and Wellness, which she'll explain to us a little later what that is, okay? She has over 28 years in the industry of healthcare, previous roles as Director of Patient Care Services, Chief Operating Officer, and Administrator. Tia has also overseen different various facets required to deliver quality, which is what people need, quality and competent. More important, those keywords, quality and competent, clinical care to, thousands of home health,
Mhm.
palliative, hospice, and hospital-based clients, with a focus on the baby boom and geriatric population. Tia also understands that the current healthcare plight in America is facing and remains a passionate, and she remains a passionate and dedicated advocate for the enhancement of healthcare services, to the underserved, you know, frail, like, and the elderly members within our community, which is what I have a big heart for right now because of this that we get into. She's a
Mhm.
mother of two. Tia enjoys working with our youth.
Mhm.
For decades, she's volunteered many school-based organizations. She works long hours, tireless with teachers, parents, community leaders, organizing programs in fundraisers and in services focused to enrich their educational experiences and improve their health-related outcomes. In addition to that, Tia also, in addition to her delivery of clinical service, Tia oversees community-based health and wellness seminars that
Mhm.
focus on providing insight and resources that empowers in others, in such areas as chronic disease, preventive preventive care, overall healthcare awareness. This is the other one that I kind of touches me because I experienced this through with my mother. She was a certified. She's also certified with Alzheimer's Association as a community educator, and so we got somebody that can give us some great info, guys. Tia also currently holds a bachelor's degree in nursing, certified clinical case manager, and is in process of obtaining her master's in nursing with emphasis on education. She's formerly served on the educational committee of the California Association for Health Services at Home and is a present member of Black Nurses Rock LHI. Right. So they got data too, Black Nurses Rock, National Action Work, Alzheimer's Association. So Tia, you got a lot there to. I got
That was a lot.
you do a lot. So you're out there. You're out there and learning and always keep an eye. So thank you. Welcome to for us to giving us your time. I know you had a long day today because you were working, and just we're just so glad that you're here. So yes,
Thank you.
thank you. So how you doing today? Still good? You look pretty like you have a lot of energy. Okay.
Yes, I'm good. I still have my energy going. And I want to thank you for allowing me to be here today, Antonio. I really do.
I really appreciate that, that you're here. I want people to get to know you a little bit because we're going to get into some good, deep stuff that we all want to know. But tell us a little bit about yourself. Where were you born? Where was Tia born?
So I'm originally from Boston, Massachusetts. Most of my family is from the East Coast, and then my family migrated here when I was a young child. And so I went to junior high and high school here in Los Angeles, California. So generally, I'm a native California because I've been here so long, but my heart is in Massachusetts.
I got you. Hey, listen, your heart is where, or your roots,
Those are my roots.
Born in Peru, blessed to be here since I was 12 years old in the USA. Peru, but I never forget about Peru. I like you, you just make the best out of it where you're living, and I love it here. Great stuff, right? I'm gonna ask you, when you were little, did you know you wanted to get into the medical field? Will you play like nurse and doctor or anything like that? I mean,
it's actually kind of funny because I did not. A lot of the women in my family are business women or working in the accounting and finance departments. And so when I went to school, I actually went to college for psychology. And I started working in the home health industry and realized that I loved it. And so nursing became my second career in my 30s. I went back to school, became a licensed nurse, and then came back to the community to serve. So I had no idea I wanted to be a nurse. I'm actually the first nurse for a long generation of family members.
Oh, nice. It was a great, caring, kind of job. It's a tough job, I imagine. Can I ask you what made you decide to be a nurse?
I worked in the home health industry on the administrative side, and I would work with nurses on a daily basis. And I started noticing that I had such a compassion for what was going on with the patients. And once I had done all that I could do administratively, I still had a yearning to do more. And that's when it dawned on me. It was a sign from above that this is what I was meant to do, because I literally quit a six-figure career and went back to school. My family supported me wholeheartedly and got my RN degree and came back into the industry. So I think God prepared me to be a nurse. It just wasn't time earlier, and now is the time.
Yeah, and I mean that's right. Everything happens in its own time, And so when you're doing the administrative work, were you like in the same area where the nurses were, except that you were like in an office?
Yes. For a long time, I was either their supervisor, their manager, and then, as you stated, I had been a chief operating officer. So I oversaw the operations for a lot of home health agencies. So I actually provided them a lot of guidance, a lot of direction. And the more I knew, the more I realized that the caring component was important to the educational component too.
I have a feeling that you walked around the hospital and you talked to the patients and gave them some encouragement or whatever situation they're going through. And because that sounds like it's that kind of stuff I've seen you. Kind of like pulled you over to be what you said, to study and get the nursing degree for that.
Right.
And before that, you were in the administrative part, right?
Yes.
How many years are you doing nursing right now? Have you been in?
So I've now been a nurse since 2012. So I'm in my 8th year as a registered nurse.
Awesome. Yeah. What do you consider to be your greatest virtue? To work, as a nurse. We know that it's a career that involves a lot of, patience, love, and a lot of effort. Because I'm pretty sure not every moment is nice and pretty. There are moments that, boy, I don't know how I would do it. I'd probably faint, all these things. But what do you consider your greatest virtues?
Oh gosh, well, I think the greatest components that I bring to the industry are compassion and competency, and I have a high level of ethics. You have to be very compassionate to deal with all types of people, and to be able to understand what they're going through. Their negative energy has actually nothing to do with you because they're dealing with something.
Yeah.
You also need to be very competent. You can't just, I hear people say they want to be a nurse, but it takes a lot of education and knowledge because you can specialize, but most nurses deal with all types of patients. So you have to understand a patient holistically. You have to understand a patient's, all of their systems. And so you have to have competency and then ethics. You're going to have to sometimes be the advocate for your patient. And you may have to be that person to say, hey, I think this is the wrong medication, or hey, I don't think this is a wise decision. And you can only do so if you have a high level of ethics and that you have a high sense of I'm doing the best that I can for my clients. And so I think those are the three attributes I bring to the table.
And I think you have another one, a lot of intuition, how fine is feeling. Because, okay, this is not working. Let's see, we get something better, like you just said. Teaches you that. I'm pretty sure you got great intuition on that. As a health professional, which do you consider on a personal level to be the most outstanding characteristic that is really essential in a nursing team?
I think it's empathy. And empathy is a lot different than sympathy. So when you're empathetic, you have a sense of understanding and you have an ability to step outside of yourself and look at others from a different perspective. And that's very important in Los Angeles as a nurse because we're a huge melting pot. And so I see patients from all generations, from all ethnicities, religious beliefs, and they may not be in tune with what I believe or what I'm thinking is the right way to do something. And so you have to have a sense of empathy to say, okay, as long as my patient is safe, they're receiving quality care, and what they're doing is what they believe in, but it's not causing them any harm or their family members any harm, you have to understand. You also need to be empathetic to the fact that they're going through something. And so every day might not be rosy. Their words may be curt, may not be kind, but you have to be able not to take it personally and also not to bring it home with you.
Yeah, that's good. So you find a way to be like a third person to just give them the best solution possible to what they're going through.
Right, right.
All right. We know that you, medical personnel, face very complex situations, at different moments, like you were saying, some are nice, some are not. I'm sure you have a few that bring up to mind, that you had that were tough moments for you. Is there one particular, a couple of scenarios that bring to mind that they were very complex? They were like tough moments. And how did you become calm? Because you have to be the calming person, right? Like you were saying, you gotta look at objectively because somebody got to remain calm because everybody's going nuts.
Right? Has to, right?
So, you have any moments that you remember that were like stick with you, that were, oh, I did my best or whatever, but moments that it stays with you?
I can only say without really, giving away any patient information that being a hospice nurse, I have had to deal when there are family members and loved ones that have conflicting thoughts on what hospice care should be and what the picture of the end of life should look like. Okay. And for example, you may have a patient who has wished not to have an enteral feeding tube. They don't want ventilation and they just want comfort measures. And, you have that family member, that loved one that wants mom or dad to just be here a little longer and they want that G2 put in, and you have that battle between the two. And I've had to be that person to say, hey, why do you want the enteral tube? Do you want the tube because you want mom to be here longer? But is mom really here? Is mom really here with us? And it's difficult to have those conversations at times because I have a family that I love to death, and I know that making those decisions can be difficult. But sometimes you have to step in and say, hey, what's best for the patient, and have family members have those difficult conversations with each other. So I think that's one of the most difficult things to do is when you're dealing with end of life.
Okay. Yeah, that's pretty tough. I don't know. I mean, I've been around, not in the hospice place, but like I mentioned to you, our mother was also like that. So you're right. Do you want to keep her alive just because you want to keep her alive, or she's not really
Right.
having a quality of life? You know.
Right. The quality
Yeah,
of life is so important.
I got you. I want to just read a little thing here on some of the people. Patricia Guillen, she says you're an amazing. Thank you, dear Delaney. You
Thanks,
got you got till I don't know if I say it right, but Taliba Woods.
to leave it with. Hey, babe.
Hi, Presley. That's my nurse. Thank you. Go, Tia. She's a good fan of you. Lady named Mari Carmen says thank you, and
Oh,
Jeremy Graves.
oh, hey, girl. That's my son.
Looking good, girl. Let me read this again from Patricia. You just typed this in. Hi, my dear friends. Tia Delaney, registered nurse, please help the listeners understand. Yeah, we're gonna come back to virus better. We're gonna get that in that question. I wrote it, and of course, and it's being um, exaggerated. Yeah, we'll cover that definitely. Things that the media talks, the things that so kind of separate the difference because you
Okay.
are living proof on that stuff. So go back on my little list here. You know, Tia, like in today's, how do you see? And that's kind of tied into what she said. The things that we're experiencing worldwide, the coronavirus. I mean,
Mhm.
what do you see? Are we this thing just keeps growing? Are we all gonna get it like a flu, and then some of us gonna be strong enough to survive, and some not? Or can you tell us a
Mhm.
little about that before you keep digging in?
Well, from my perspective, a couple of things. One, when we were first faced with this coronavirus information, unfortunately, we were not given all of the information. So the COVID virus spread rather rapidly, and we did not have correct interventions in place.
Okay.
Our numbers are very high now as far as the numbers of people who are considered possible coronavirus patients. And I think that's very important for people to understand. I think currently we have about 210, 211,000 people that may have the coronavirus, but probably 180 or 190,000 of those clients or patients are not confirmed. They're either tested or been sent home to self-isolate because they've been in contact with someone else. And even though we've had about 4,000 deaths, and I have to say, even though that is only 2% of the people that have actually been diagnosed or been thought to have the disease that
Wow,
have actually died. Now, don't get me wrong, 4,000 deaths is a
that's a lot.
lot of
That's a lot of people.
one death can be too many, but
That's
I
true.
just want people to be able to sometimes put those numbers in perspective. So that's my take on it. Do I feel that all of us are going to, this is the end of the world and the way they're making it seem
Yeah.
like 200,000 people are going to die from this disease? Personally, from my perspective, I don't know where those numbers came from, and I find that really huge to fathom. But I do know that there are a lot of risk factors related to this pandemic, and that we have to be very vigilant in understanding that it's very serious, and we have to continue to put the precautions in place so that we can flatten the curve and minimize our risk.
Okay, well said on that part. You know, as far as the COVID, it's coronavirus, but the legal name or medical term is COVID-19, right? COVID.
Yes.
Does that stand for anything? I mean, I didn't dig into that. Does it mean
Yeah,
anything?
COVID-19, you giving me some tests here, but Corona, it's CO is for Corona, the VI is for virus, the D is for disease, and the 19 is for 2019. So that's how they have COVID-19.
Gotcha. Okay, well, thanks for clearing that up.
You're
Though.
welcome.
Coming back to that, was this already out there a few years ago, and it just got out of control? Was it
I'm
like
not really certain. There is different information leading up to that, but it is a different version of SARS. And so you remember we had the outbreak of SARS.
yeah?
And I kind of compare it to the flu. You have the influenza A, then you have influenza B. So COVID-19, actually, from the information we've been given, was a strand that actually was found out in 2019. I know a lot of us discovered it in 2020, but the outbreak really began in 2019, the latter part. So I have friends and family members who state that they have experienced the signs and symptoms of COVID-19 as we know them today sometime last year during flu season, and were never diagnosed with COVID-19, have come out positive on the other side, meaning all of the signs and symptoms are gone. So I truly feel that we were experiencing it within America in the latter part of 2019. We just didn't have a name for it.
Gotcha. Question, another one, based on your, professional group that you guys talk, did this thing start like really in China, or does it did it? I mean, it looks like it.
That's where statistics are coming from. And I can tell you this, people like you and I, Antonio, will never know. There's so many things that happen behind closed doors and information that is not shared with us. And so what I do encourage people to understand is, does it matter where it started? Because that, I believe, is how we've had a lot of racism and bigotry attached to the disease. And so, people calling it the Chinese virus, or saying it's here because of Chinese people, causes that dissensions amongst us. And as a Black woman, I've experienced that, and many people of our race have already experienced that racism just based on the color of your skin or your nationality or ethnicity. So where it originated, I think lay people like us will never know. Just know that now we do have it in America, and we need to do something to, like I said, flatten that curve.
All right, fair enough on that one. Thank you for that. Okay, what are the basic symptoms, like, before we get tested, like, hey, I think I'm a little COVID-19, what are the symptoms for that?
That's an excellent question. So the thing people were looking for in the beginning were the fever and the dry cough. And so I want to let you know that you may not experience that fever, but COVID-19 is a respiratory disease. So you are going to have some type of respiratory effects if you are not asymptomatic. And so you'll either have a dry cough, you may have a sore throat, you may have chest pain, shortness of breath. Those are some of the things to also be looking for, and you may not have that fever.
Okay, all right. So shortness of breath. The fever doesn't have to be, but the dry cough.
The dry cough, the sore throat, and any chest pain. So one test they ask people to do is to hold their breath for 10 seconds, and it's a real 10 seconds, and see if you feel any tightening in your chest, any chest pain during that time. Again, if you do, that does not mean run into the urgent care, because we're trying to minimize people coming into the hospital at this time because we're full. But that's a test that you can do to say, hey, I'm feeling this. Let me see, or call my clinician and see if we can have a discussion about maybe other signs and symptoms I could be experiencing.
Perfect. How does COVID-19 spread? What's the...
So COVID-19, there's been a lot of back and forth, but I haven't seen anything different, that it is a droplet disease. And so we have airborne diseases, we have droplet diseases, we have different types of contact precautions. So a droplet disease means that when I sneeze, when I speak, when I cough, I'm expelling something from my airways. And that particle can only travel so far because of how heavy it is. And so eventually it's going to travel and then drop onto a surface, hence why it's called a droplet precaution. So it's spread because we are close enough to someone else where we're expelling those microorganisms into their airways, their nose, their mouth, or onto a surface that they are later touching, and then touching their face, their nose, their mouth, their eyes with the virus on their hands. So that's why it's so important, the hand washing, the sanitizing of areas, because droplets can remain on sites for a duration of time. So the person may not be in the room anymore, and maybe they sneezed at 12 o'clock and you came in the room at 3 o'clock and put your phone on the table. And there you now have those possible droplets on your phone that you bring up to your face and now near your mouth.
There's definitely many ways of getting it. So sneezing, it's for sure one of them, right? Because it's on the air. But that's why they say to remain about 6 feet from each other, right? In case something happens. Does it live on our clothes? Does the thing live on our shoes, or does it live on anything?
Well, I can tell you that a lot of microorganisms live on the bottom of our shoes, and that's just known. So if I said COVID-19 did not, that would probably be a lie. But it's not one of those things where it's the only microorganism on the bottom of your shoe. Now, as far as staying on your clothing, yes, because it's droplet. So if someone sneezes or coughs or expels those microorganisms, yes, it can. And so that's why they recommend that clinicians, when we come home, to change those clothing, to wash them, strip down and don't bring them in the home. And in a lot of homes, the general precaution is when you come in from the outside, and this sounds like old people's tale, but when you come in from the outside, we don't believe in putting your outside clothes on the bed. So don't come in from the outside after you've been at baseball games and doing all these other things you do in the field. And then you come and you sit on everything without in your home. So I've always had that rule anyway. And so if you know that disease microorganisms can be carried on the bottom of your shoes, you should be taking your shoes off anyway before you go into the home.
Okay, all right. And then wash our clothes and just
Mhm.
shower and just your pajamas or whatever you're gonna put on or chillax. So, for those who don't see it, could it be that people that look healthy, could they be infected and have the symptoms and we don't even know? Is that
Yes.
possible?
And that was one of the things about COVID-19 that the clinical environment we did not know about. And I think if we would have had that information earlier on, the spread of COVID-19 would have been a little less. Because I could currently be asymptomatic, but have been treating a patient with a respiratory disease and now have given them the virus and they show the symptoms. And so months ago, I feel that if we have that information and we're equipped with the right PPE and using masks at the time, then we may have had a lesser number of people infected. But we have to go with what we know now and just know that you can be asymptomatic. So social distancing, especially for those who are out and about and in the clinical environment, is very important.
As I mentioned, the healthy, let's say, usually we kind of say healthy because they're young, but sometimes it's not really the truth. They could be all messed up inside. But we say it in a way because it's kind of generalized, right? You're younger, you have everything newer, and compared to somebody older. Could it be that how I'm just gonna say some kids that were just partying, they're partying in between. Let's say like a week ago, 2 weeks ago, they were in Florida, they didn't care about spring break. They were just having fun. They could be strong as hell, right? They could be strong inside. They can be all drinking and playing volleyball, whatever, at the beach. But when they probably time to go home and see the grandparents, they mess up their grandparents or anybody that's older that's in the house.
Yes.
And that's one way to be careless, right? One of the ways, stuff like that.
And that's why people thought it was very careless, their behaviors, because, as a youth, and we've been there, we feel we're invincible. We hear these numbers and we think it can't be us. But we have to remember our loved ones. We have to remember our family members. If we're going to visit our family members in assisted living facilities, those other patients who are also frail and elderly. So yes, they could have been asymptomatic and now given the virus to someone that they care about.
Yeah, and as far as trying to take care of yourself, wearing gloves, wearing the mask, does it make a big difference? Does it help?
Yes, it does. And so there's a couple of things. So the number one thing, and we've said it a million times, so for 1,000,001, is hand washing and hand hygiene.
Yes.
It doesn't get any better than that. So again, washing your hands, soap, water, and friction are the three elements to hand washing. And if you want to know the one that's the most important, it is friction. And so I tell people to explain it to their children is to wash your hands as if you have glitter on them and you're trying to get all of the glitter off. And we all know how hard it is to get rid of glitter.
Oh, yeah.
So hand washing using friction is most important, and frequently. Sanitizing areas that you're going to use. So desktops, your phones, your doorknobs. Clinicians, we sanitize our steering wheels at the end of the day. So using things like a Sandy wipe or a Clorox wipe to wipe things down is very important. Now the masks are important if you're going to be out and about running errands for two reasons. One, if you have a compromised respiratory system or immune system, then definitely I would recommend wearing a mask. Now they were getting new data out that was recommending that more people wear masks rather than less people wear masks, because they're seeing in other countries that it has helped to flatten the curve. So you may now start seeing more people wearing a mask. But we do ask that when you're going to take your mask off of your face at the end of the day or whatever you've been doing, wash your hands first or sanitize them Then take your mask off from behind your ears, dispose of it, and wash your hands again.
Wow.
Lastly, when you're using gloves, you can use gloves. I prefer hand washing. If you're out and about and you keep on those same gloves, you're going to get in the car with those gloves and you're not going to sanitize them. And you're going to touch your steering wheel and your stick shift and your keys and your phone. And then you take off the gloves, but everything's been touched. So if you are wearing gloves, change your gloves frequently and wash and sanitize your hands in between the gloves.
So it's a lot of hand washing. Does it matter the temperature? Could it be cold water? Does it be warm, hot water? I heard
warm and hot water is always best, but you know, if you do nursing in third world countries where you're not going to have that hot water, but you still have to be able to minimize your risk for all types of diseases. So friction is the most important element. And
Tia, the masks, the ones that are made of like little paper, are they only good for a couple hours and you got to get rid of them?
Yes.
Is that true?
So these are the paper masks, and you can wear them when you're out and about. But when you get home and you're in your own private environment, yes, you need to get rid of them. These are not N95. So what they really do is protecting your airways from someone sneezing on you and you touching your face. But there are still open areas around the sides. So they're not 100% protecting you from the virus. So again, when you get home, you need to take these off and dispose of them because now the outsides are dirty.
Gotcha. I'm going to read a little comment here from Dre Worship. I don't know. You're awesome, Tia Delaney. Dopeness, or maybe somebody
like hey,
Dre. And we have Sandra Knighton. That's my baby. I love you, Mom. That's your mom?
That's my mom.
Daughter's giving your advice, Miss Sandra. So we're all appreciative of that. And she says this following day, you're a shining light in our time of darkness. Wow. Continue to shine and to pass on information to others. Your message is very heartfelt. Thank you. Kisses and mom.
Thank you.
Let's see, Taliba Woods. I love how you say your clients are not just patients. And speaking about them and to them with dignity, which is what you said before in the beginning.
Yes.
From Las Vegas, Sherry Sutton. Hey, Antonio, thank you for doing it. Appreciate it. And Dre speaks Spanish. Like he says, buen trabajo, Tony. Talking Spanish. I like that. So is there any antibiotics that work that cut off yet or not yet?
Not yet. I haven't had anything come down the clinical pipeline regarding a specific antibiotic that works for the COVID-19 at this moment. And because it's a virus, it's just like the flu. It's viral. And so usually there's not an antibiotic treatment that you're going to receive for it. You need an actual vaccination that's going to be a preventative measure or minimize your risk for catching the disease.
Gotcha. How long is the virus incubation period?
So what we're learning is between 1 to 14 days. And so I know that's a big range. And so what we're saying is if you start feeling symptoms, then you need to go ahead and quarantine yourself. And the difference between quarantine and isolation is I may have the disease, so I'm going to remove myself away from the public to see if I have other symptoms. If say about 5 days, you don't show any other symptoms, so say maybe you had a dry cough and within 5 days that cough has gone away, there's no shortness of breath, there's no fever, there's nothing else that you're noticing, then you're okay to come out of that quarantine, but you still should take those precautions. Isolation is going to be if you're actually been diagnosed with COVID-19 or if you have enough symptoms for us to say, okay, you have a mild case of COVID-19 and now you need to isolate. Now, the recovery period can be up to 2 weeks for people who have a mild case of COVID-19, but it can be anywhere from 3 to 6 weeks for someone who has a more severe case. So if you do decide to isolate yourself because you know that you have COVID, you have all of the symptoms, if you start noticing that your symptoms are getting worse instead of better, then that is the time to start involving clinical assistance. And that means a physician, a nurse, a clinical team to say, hey, I've been self-isolating, but I'm feeling worse. I need to now come in and get other interventions. We don't want you sitting home isolating yourself and getting worse and thinking, I'm afraid to go to the hospital, because hydration oxygen, perhaps utilizing, you may need to be ventilated if it gets to that point. All of those resources are not going to be in your home. So you want to get somewhere where those resources are now instead of later.
That is so true. So true. Great advice, Tia. Yeah. Do you have an idea what the number of people are infected in the South Bay area, LA City, and Torrance, Gardena? Is it keep growing? I know it's growing. Any number?
I don't know per South Bay, I don't. I can tell you though that California is probably fourth or fifth on the list of the highest number of possible cases of COVID-19. New York, of course, has the highest, and a lot of it is based on our population and the density of the population, the people on top of people on top of people. So unfortunately, I don't have the numbers for like Gardena or Hawthorne.
Okay, I have a question about New York in a minute, but how do you see the virus spreading in our cities? Say any city, the local here. How? I mean, is it? Are we being more careless? Or, are we paying attention now? Do you think?
I can honestly say in Los Angeles and from my travels, because I travel almost every day as a traveling nurse, I travel throughout the community. I have not seen a lot of people out and about. I don't see a lot of social gathering. I see everyone using Zoom and having parties that are virtual. So I think we're doing a great job. And I heard something either a day or so ago that California was doing a lot of great work to flatten our curve. And so I'm very proud of us for taking it seriously and not panicking and start doing things that were irrational, but listening, washing our hands, staying in the home, and social distancing.
So a lot of hand washing. I gotta talk to my kids a lot.
I know. My hands are raw.
The things I'm getting here. Wash my hands every time.
Right.
So okay, New York has a lot of population and stuff like that. Did it happen there because a lot of people walk close to each other? They take a subway train, all that stuff. Why do you think that has a huge number compared to other states or other cities? Let's say other big cities.
Right. Well, the data is showing that it's because, again, it's a metropolitan area and it has a very dense population. A lot of people living within a small square footage in New York. And so also the subway system. We have a subway system here, but LA folks are not really using that subway system. So that's the main method of transportation. Also, there's a lot of travel within New York. A lot of professionals and business travel happens it's a hub. And so we have a lot of people that are traveling in and out, traveling through the airports, bringing things, taking things with them as far as microorganisms. So that's what some of the research is showing with New York. It's because of the density and the population.
That makes sense. As a health professional yourself, what recommendations, I know you're giving some, but just to maybe recap a little bit, can you give us to protect ourselves, and prevent the spread of the virus? Which measures do you think will be most, in addition to hand washing, anything else that are good and important?
Okay. So we talked about, cleaning the surfaces. So I, highly recommend cleaning your surfaces, cleaning your doorknobs, cleaning your keys and your phone, and making sure that if you're using like a Clorox wipe or something, that you allow it to air dry. Sometimes people wipe it down with the Clorox wipes or the alcohol, and then they wipe it down with a dry paper towel. So let it air dry. If you read the back of those things, it always says, let it air dry. The other thing is now is a really good time to work on your immune system. And so I take a lot of vitamins and supplements, and I'm in the battle of being a vegetarian / sometimes vegan. And I think it's really important that we now take the opportunity to look at what we're eating and how it's affecting our immune system. So those are ways keeping ourselves healthy. We're told to quarantine, but that doesn't mean you can't go out for a walk. That doesn't mean you can't also do some self-meditation, doing some things to decrease your stress, which decreases your cortisol levels, which is very important as well in fighting any type of disease. So learning those ways to manage your intake, your vitamins, your autoimmune system, and your stress levels will also be very helpful in helping to minimize your risk for catching the disease.
Should we drink a lot of water throughout the day? That help?
Yes, hydration is very important. I'm glad you brought that up, Antonio. Hydration is very important. We talked about that it's a respiratory disease that travels through our mouth and our nose into our lungs. And so making sure that you keep your mouth hydrated and not having a dry mouth. Also, hot teas with ginger or with turmeric is also another way of helping to wash down those microorganisms. Now, another good protector is maybe a probiotic to help your gut health, because you're washing those microorganisms through your body into your gut. But it has been shown, I've read a lot of data about using being hydrated in the hot teas with ginger, with the turmeric, with the lemon, with the zinc, those types of things.
Question for you. In the mornings, like when I get up, I get like warm water or almost hot water, and I like do a lemon, I squeeze it, and I drink it. And then
Awesome.
I don't know how good is that, but let me hear your opinion. Then I get like this garlic that's like almost like liquefied, I guess. How you say it? I mean, it's not a whole garlic. And then I have a orange right there, a little bit of honey just in case, because I know it's gonna be nasty.
Sure.
And then so here's what I do, and then I have these herbs that I take too. So first I drink the lemon in the morning, right, with the water. Enough. I don't know. You tell me how good it is, because I heard from other people. So I drink that. So I already got some water ahead on the system. Then I get a teaspoon of garlic. I mean, a regular teaspoon, and it's all like watery, right? So I just like drink it, and it's the nastiest things I can taste. But I'll say that in a second. Why I'm giving it a shot, and you tell me your opinion. And then, of course, right away I get the other green stuff that I drink, herbs and stuff like that. Follow it, and the orange, and I just like bite it like crazy because that taste is tough. And did I hear, or am I correct in hearing that garlic is a good antibiotic for pretty much a lot of illnesses or diseases that are out there? Is that what do you think?
It's not a good, but it's a great supplement. It's a great herb to use. So garlic, turmeric, vitamin C, zinc, all of those things are excellent to use. I think your morning regimen is excellent. You should be doing that every day, regardless of what's going on in the community at the time. Okay. I think you have an excellent morning regimen. Yes.
I'm going to add the ginger, the turmeric, the C, and the zinc. Right? Zinc?
Yes, zinc as well.
Add these into my list.
And again, for anyone who is watching, always before you start taking any type of supplements or any type of herbs, even though they're considered to be natural, if you are taking any type of medications, always check with your clinician first to make sure that it's okay, because there are a lot of herb supplements that interact with medications. So especially our diabetics, our hypertensive patients, or patients in heart failure, make sure that you always check with your physician or your nurse practitioner to make sure that you can take those supplements before you start taking them and you have a reaction.
All right. A couple people here are just gonna but Jenny Flowers says hi. June Simmons, it says beautiful and smart. Love Cheryl Brown. Yeah, thank you. You know.
Oh, that's so nice.
You got a friend named Melanie Petway. Thank you, Tia. T. Leva Woods is a good fan. He's always there. Keep practicing the social distance.
Yes.
And Sherry, which was on a little early, said thanks for getting clear in that info of not only wiping it, but just letting it air dry.
Yes. Letting it air dry.
I'm drinking green tea right now. So thanks.
Yeah, green tea is wonderful as an antioxidant in general. You know, I was just talking to my sister the other day. I drink green tea all of the time. You know, if you do some research on some of these herbs and supplements, you'd find that green tea is an excellent antioxidant and should be incorporated in someone's day-to-day diet. Now, you should probably drink it in the morning if you're going to have trouble sleeping at night, but it's a great antioxidant as well.
Good idea. Good idea. Yeah. What behaviors do you consider that we should not perform, that we should not do? You know, in other words, because you kind of seen some behaviors. What should we not do?
Now, I can address it physically and I can address it mentally. So let's first talk about mental, because we talked about a lot of physical. So one of the things I really encourage mentally is mental health. And I think it's important for us to wake up in the morning and not turn on the news. We are being inundated with so much information or misinformation or conflicting information about COVID-19 that it's causing a lot of anxiety and depression and a feeling of being overwhelmed and not having the power in our community. So I think it's really important that when we wake up in the morning to do a little check. How am I today? What am I doing today? Where are my emotions at today? Before we start consuming information about COVID-19. Then, if you are going to look at the news, don't watch it all day. Find
Mm,
some other activities during your quarantine time. Spring cleaning, reading books, interacting with friends and loved ones, playing games. Some of our kids are home from school now, so we're having an opportunity to learn and interact with them a lot more. So, really looking at your mental health, because we know holistically that mental health has a lot to do with our physical health and our ability to minimize our risk for catching all types of diseases.
I
Now,
agree with you
physically,
there. Go ahead.
physically, some of the things we should be doing, what we talked about earlier with the hand washing and those precautions, but also, again, taking that walk, going for that bike ride, still working on our physical health, still working on clearing our airways. So when you wake up in the morning, take that deep breath and breathe out slowly, expand those lungs, make sure you're taking in that fresh air, go sit outside for a little while, but work on those things as well. Look, we're snacking at home, so let's not be consuming a lot of high calorie snacks because we don't want to survive COVID-19 and come out a diabetic. So think
Oh,
about those things as well.
yeah.
So those are some of the things. The other thing I want to stress is when we're going out into the community is having anxiety and a fearful approach of how we're doing our shopping. We have to still be mindful of others and mindful of our seniors and those who are disabled or frail who may not be able to get to the store the way we can. And then when we get there, there are no resources for them. So also be mindful.
I agree. So mentally, not be, of course, be aware of what's happening around our surroundings, but don't watch too much news because
Hmm.
it kind of depresses you, or I mean, you get the wrong info. Everybody's getting this info, that info, right?
Right.
About since September 9th or 1, I said I'm not gonna watch any news, so I'm not
Hmm.
watching. That part is the COVID-19, so I have no choice. But sometimes you just hear it,
You
but you just
do.
don't dig into negative news or anything like that because I mean we have things to do. I mean I can't
Right.
worry whatever happened over there. I can we can control our house, our kids, and all that stuff, our surroundings. Um, and you're right. Is it true sometimes in your medical field that uh, there are people that were kind of sick or whatever, but they had a good attitude and with good treatment, good caring, they recover, right? Because their mind is on getting better, not getting worse or digging
Right.
a hole in a grave in them.
Yeah,
Oh,
there's tons of evidence-based research about the holistic approach to a lot of diseases, to cancer and a lot of what we consider terminal illnesses or diagnoses. So a holistic approach to everything is definitely the approach I take with my patients.
gotcha. Tia, you touched on raising our immune system by by
Mhm.
using zinc, vitamin C, and all that stuff. Why do sometimes could be true or not that this COVID-19 affects different ranges?
Mhm.
Somebody that was in good shape and all that stuff. And not only it's not only for the old people, but why would
Mhm.
something like that happen on somebody that was kind of fit? Was going to the gym, eating. Could it be that they had something else wrong with them?
It could be. Now, the numbers do show that the majority of people who have the highest risk are going to be our seniors, our frail and elderly. And then next will be those who have what we consider as comorbidities. So our heart failure patients, our cardiac patients, our respiratory issue patients, COPD, asthma, bronchitis. However, there are some young people who are being affected by this disease. So we don't want anyone to be fooled and think they're invincible. But they may have underlying conditions that because they're young and they weren't getting seen by physicians regularly, they had no idea they had. So that's also important. It wasn't until I was about 30 years old that I found out that I had a cardiac condition.
Oh
And
wow.
so up until then, I didn't feel like I needed to go to the physician, and I was healthy. I was, doing all types of things that healthy young teenagers and adults do. So they may have underlying conditions that they're not even aware of that become prevalent when they actually get COVID-19.
Yeah. For the most part, though, kids are pretty strong. They're not get affected that much, right? For the most part.
Hmm.
Lucky
Hmm.
kids, yeah.
Definitely.
Um,
Definitely.
uh, what do you think would be a short-term solution to lower the number of people getting infected?
I think we have to continue to practice our social distancing and to act as if everyone has COVID-19. If we all act as if we are asymptomatic but could be carriers and take that with us, then I think we'll be more conscientious of what it is that we're doing every day and who we involve ourselves with every day. If you feel that you're carrying a deadly disease, you'd be less likely to go visit your grandmother and hug and kiss on her if you just automatically program that into your head that something is going on with me. So I think taking that approach with our seniors, with each other, with our children, with those who have small babies, think about it that way.
Gotcha. Um, what should we do? If I hope you don't have it, I hope I don't have it, but what if we have a family member that tests positive? What should we do?
So
Let's say they live in the house.
family members that test positive, we have them.
Okay.
And that person then has to be isolated into a room where no one else is going into. It is very difficult, but it's being done all the time across the nation right now. And so a couple of things is that person has to be isolated in a room and they cannot come out of that room and be around the others that are in that home. They need to have a mask. If when you're feeding them, you need to mark the glasses, the spoons, the utensils that they're using so that after you wash them, they're using the same utensils over and over again. When you're leaving things for them, leave them at the door. So, hey, honey, your sandwich is at the door, and then you step back. Now, you can have your mask on. They'll have their mask on and get it. Now, remember, being isolated can be very, very lonely. So make sure they have resources in there, some television to watch, videos, a computer to watch movies, and now we're interacting with them either using a phone or FaceTime. We're not just going to put someone in a room and not interact with them. So also remember to interact with them as well. But you can self-isolate at home if a family member has it and minimize the risk of other people catching it within that same home.
Okay, got it. So it's a good idea what you said. Have them have their own utensils, only to them. You wash what you get back to them. That's their, like in a certain box, you put everything that they're gonna use, their own plates and all that stuff.
Right. And then one more thing I like to add is when they're in that room, once you're done, once they're finished isolating and they've recovered, all of those things in that room should be washed. So we should be washing those pillowcases, those sheets, the clothing, all of those things should be washed separately. And that's just an extra added layer of precaution. Now, even though some of the people I know, they're going to throw all that stuff out.
Yeah.
But if you wash it in the machine with hot water and, detergent, et cetera, and then utilize them again.
Is it a good idea to have Lysol in the house? Spraying around.
Definitely. It can never hurt to be cleaner than necessary. So it can never hurt to be the cleanest you've ever been. Lysol's never going to hurt.
We're all going to be changing pretty soon our habits. I get it.
Right. Really change our habits, exactly.
Check it out. I think right now, like many of the CVS and all stuff, I hope they don't run out. But alcohol, the alcohol you can get when you get a cut, you put it. Say I have a bottle in the car and I don't have a place to wash my hands, but I want to keep it clean. Could I pour on my hands and then be like soap?
You can pour the alcohol on your hands. We recommend 60%, and I think the rubbing alcohol is about 70%. So definitely, just know it has a really huge drying effect.
Yeah.
And it's not the most recommended when cleaning surfaces because it air dries really quick. If you ever notice how quickly it evaporates when you put it on the surface, but something is always better than nothing. And then when you get home, you can go ahead and wash your hands.
Okay, perfect. It's good to know. I know you mentioned, but just double checking again because some people can click in a little later. And I have questions. I'm going to go back. What the population that we have? I mean, what should we protect more? The elderly or more elderly than the children, right? I mean, who should we be caring for more at this moment? Or making sure that
the numbers are still showing that the highest risk factors are frail and elderly, and then those who have comorbidities of cardiac issues or respiratory issues such as heart failure, asthma, bronchitis, COPD. So always our frail and elderly we're going to look at first. It doesn't matter if they were very healthy all of their life. Once you're 70, 80, 90, your immune system is automatically compromised.
Okay. Yeah. This situation that we have, brings anxiety, stress in a lot of people, worries, all that good, not good stuff, all that stuff. What tips that you give? I'm pretty sure where you work that you can give us to combat these points, which to give us more peace or calm. Uh,
Mhm.
because we all get a little crazy sometimes. We can hear more and more of these cases.
Right.
So,
Especially quarantining with others. Well, like I mentioned earlier, it's very important to minimize your intake of the day-to-day news. If you feel the need to watch it, don't let it be the first thing you see in the morning or the last thing you see at night. But go ahead and pop in if you need to see the news at least on a daily basis. Self-care, mental care, some meditation. Maybe you've never meditated before. This could be a good time to learn how to meditate. You can go online and you can look at meditation for dummies. There are a lot of numbers you can call. So Kaiser and other healthcare companies have numbers that you can call to speak to someone to say, hey, I'm feeling stressed, I'm feeling overwhelmed. Those daily walks that we're doing, and to think about those people who are isolated, who were normally isolated anyway, but now maybe feeling more alone, and interact. So social distancing does not minimize social interaction. With modern technology, we can do a lot of things to kind of bring us at peace, to know that grandma's doing okay or my sister's doing okay by picking up the phone and saying, hey, how are you? Or let's FaceTime or let's Zoom. So look at some of those things that you can do to kind of de-stress yourself and how much that you're intaking of the negative noise. You want to minimize that negative noise.
okay, appreciate that. Yeah, this, COVID-19 and all that stuff has basically changed all of us in different fields, and it pretty much affected everybody, right? People have that have a regular job to the high paying job. It's affected everybody.
Right.
I think it makes us focus on give value to what we forgot. Like when we're at home. I mean, more time at home. I mean, it feels kind of weird that we always lived in this fast pace, especially here in LA. Maybe New York.
Right.
I,
Right.
I think I know we wish it's not here. We wish it goes away fast, and that's what we all want for many, many reasons. For all the people that have a hard time. But at the same time, do you think it kind of help us appreciate everything we had that we didn't really, take into account? That man, I can see my kids a little longer. They're home. Well, what do you give me some input on that on that side of the question?
Well, I am a spiritual person. And so I think anything that is given to us, we have to sit back and remember how blessed that we are. So I think this has given us all the opportunity to remind ourselves how blessed we are. Because if we're still here talking about COVID-19 and we're still wondering how we can beat COVID-19, that means we're not suffering from COVID-19 ailments at this time. And that's a blessing. And yes, lots of people have lost their jobs and lots of people's lifestyles are going to be changed. And we still don't know what all of those changes would entail. But I think if you're spiritually grounded and you remain spiritually grounded in whatever faith it is that you have, then you will make it through this. It's really important when I'm talking to my clients about other things is, I say to them, think about the toughest thing you've been through. Now, is that time tougher than this? And if that time was tougher than this and you made it through, you're going to make it through this okay as well. And afterwards, think about the lessons that maybe your God wanted you to focus on. I'm learning that it's a blessing to have my family to be there to support me, to be there to give me energy and support and guidance. And you just realize how wonderful those people in your family are. So that's a blessing to me, something that I'm pulling from this. So I think we have to look at our own spirituality and what it is that we're going to learn from this COVID-19 pandemic.
And I'm pretty sure we all gonna learn a lot, whether we like it or not. We just have extra time for reflecting and appreciating what we have. Let's see, some people say here. I know she came in late. Oh, I have my niece here. She said, "Thanks for the great information on the D's, the garlic, the zinc, and the social distancing." She wants to stay healthy. And Patricia, so is there. And one lady said we should cover, but she says, should I wear the mask when we go out or just when people are sick? You said pretty much wear.
When you go out, yeah. Now, a few weeks ago, they were saying you don't need to wear a mask when you go out, but I recommended it for people who were ill or compromised. Now they're saying to help flatten the curve a little more, and what they saw in China was that everyone was wearing a mask. And I know it's just been recommended at my healthcare facility that now we're going to wear a mask, and we're going to get an influx of a lot of new masks.
Oh, nice.
That we can wear one mask for each patient. So yes, if you're going out and you know you're going to be interacting, go ahead and pop that mask off. But remember what I said before you take it off, wash your hands, sanitize your hands, take it off, and then wash your hands again.
Excellent. Robin Renee says, I heard that we should drink water every 15 minutes. Is that true?
Rob, you're going to be floating away. But it is important. We talked earlier about keeping yourself hydrated, keeping your oral cavity from being dry. So definitely hydrate, hydrate, hydrate. And that's what's good for a lot of things. So at least at the end of COVID-19, you'll have great looking skin and hair, Robin.
Okay, there you go, Robin. Good answer. Jose says hi, and Patricia he likes that how you mentioned not to. This is Patricia Viema. How you talk about don't watch too much media. It's a lot of Netflix, a lot of funny movies, a lot of good heart movies. You can check it out.
Right.
Right. Renee Higgins said thank you for the wonderful information. And yeah, finally, what advice could you leave us with, to take into account? I'm sure anything else that you want to touch on. And then I want to, before the last one will be about the foundation that you're doing. But what advice can you give to us, on a summary to all of us? Remember.
We touched on a lot of things. Again, the hand washing, sanitizing of the surfaces, self-care. So focusing on self-care. Also, if you are concerned, if you are suffering from the symptoms of COVID-19, to do your own tracking. So taking your temperature every morning before you have your coffee, before you start your day, and keeping a log. If you have a pulse oximeter in the home and you can measure your O2 saturation, keeping a log of that every day so that you have some real numbers and you can lessen your own fear. Also looking at what it is that you're intaking every day as far as what am I eating? Am I eating healthy? Am I taking supplements? Am I taking the medications that are prescribed for me so that I can remain healthy? And last but not least is staying spiritually grounded, that we'll remember to be kind to each other.
Yeah.
When we're out there in the world, we're not treating each other as lepers, but we're treating each other as brothers and sisters.
That's right.
We can only get through this together, whether we're clinicians or non-clinicians, not be important. What's important is that I want to make sure that the person next to me is just as safe as I am. And the only way to do that is to work together. So take nothing else from this besides, of course, hand hygiene. It's about treating each other with respect and with dignity and with empathy and compassion.
That's a great message. Because at the end of the day, we're all in this together. We're all going to make it through.
That's right.
So
that's right.
Well, appreciate that part. One last thing, Alice and Aaron Bennett, thank you for providing all that great information, as they say.
Thank you. You're welcome. You're welcome.
And can you just tell us just what Eyes of Love and Nursing and Wellness is about?
Yeah, great. Thank you. So before we close, Eyes of Love Nursing and Wellness is a company I started about a year ago. And it started because I was doing education in the community on chronic illnesses, so hypertension, diabetes, CHF. And I realized how important it was to ensure that people in the community, the underserved, the vulnerable population had this information. So what my goal is with this company is to be able to provide this information in any type of open forum. So going out, I've been doing it in cigar lounges, which seems a little odd, but we found a lot of people gather there, and it was a great way to start spreading information. I've also been doing it at local churches and community events, and basically sharing that knowledge so that people become empowered with their own health. I think that's something I've seen in my community as being a clinician in the Los Angeles area, is that we believe that we don't have any power of our healthcare outcomes, and that is wrong. We do. And you have to, of course, listen to what your physician is saying as far as listening. It doesn't mean you have to believe everything, and it doesn't mean that it's the final word. You have to have the information to empower yourself to go out there and do your own research and to be able to say, if I do A, B, and C, what's going to be the outcome? So giving people the information so that they have more control over their health and the health of their loved ones is my focus.
Excellent. And so, well, I know you have the same things that we think about the elderly and all that stuff. We'll be talking about more in a little bit on their own. But I want
Right.
to thank you for taking the time, for being available and to share for these great people that I'm sure they're gonna share it to their friends and say, hey, listen, man, yeah, it's there. You know, she's hope we never need her as a nurse, but hey, she's giving some info because I don't want to get sick later, right? But
That's right. That's right.
you know, but it's about learning, educating ourselves, like you say. The more we learn from professionals like you, and we make our immune system better,
Mhm.
and take care of our elders, and all these, and just be good to people. We're on this together. We'll get through it. Thank you for being available. Really, really
Thank
a lot.
you.
And I'm
Thank
sure
you.
everybody there that made a nice
Thank
comment.
you, Antonio. I'm really humbled that you reached out to me to do this. I'm really glad that I was able to, that I was provided with the opportunity to speak to the community about not only about what I do every day, but also about COVID-19 and about how we can help heal each other. So I thank you for having this forum. It's very, very important.
Thank you. It's really helpful. And I'm pretty sure I'm going to keep sharing it to our friends and tagging a bunch of people that would like to hear it. Thanks for being available. And everybody, really appreciate for tuning in and share it. And we appreciate you being with us.
All
Talk to you
right.
later.
Thank you. All right. Bye-bye.